Okay, good evening, everyone. Yeah, today we have been listening to all the topics. All of us want to live long. So, yeah, I'm sure the whole floor will say yes. All of us want to live long. So, that is what regenerative medicine is about. And we will talk about that. Just now the two speakers already told you all something about stem cells. Tansri just now, I think he gave a basic. Then Prof. Jela went through and told us how we can grow these cells in the lab. So my topic will be how can cancer patients can be helped with stem cells or regenerative medicine. How can we help our cancer patients? So actually, what are stem cells? Stem cells are actually like spare tire. They are spare cells in our body. They're about 150 to 200,000 spare cells. So whenever the body needs, it will go there. So the more stem cells you have, the better it is for healthy lifestyle or healthy, whatever sickness you are facing. So here, the stem cells, as we get older, the stem cells become less and less in the body. The stem cells get less. So also, as our body gets older, you need more stem cells. That is normal process of aging. Normal process. That is how we age. So now what we do, regenerative medicine is to replace. These are stem cells which are undifferentiated. They go to any part of the body. They can help. These are cells. So to replace damaged tissue or organs, like as we get older, like diseases, like you have hypertension, diabetes, or let's say you have some tuberculosis, or last time like what we had COVID. So that's the time your body is under stress. It needs more stem cells. And then you come to trauma. Trauma means any injury. When you have injury, you have to recover. And then examples of regenerative medicine. So you can either have some stem cells, or you can grow these tissues. It's called 3D tissue engineering. You can make some. You can grow your own skin in the lab, or last is to have regenerative, either injection treatment, or you can go for oral treatment. It all depends. Okay, the next one. So what is stem cell therapy? It's known as regenerative medicine, and that promotes the repair response of the damaged tissue or organ. Okay, these are stem cells. So suppose you have a stroke, your nerve cells are damaged. So stem cells will go to your nerve cells and help the nerves. If you got heart attack, your heart will need stem cells. So these stem cells will go and help your heart. And if you have muscle injury, it will go and help your muscle. The stem cells will go and help to regenerate your muscle injury. And the last, the liver. Or liver is injured, or liver is damaged. So you need more stem cells. So it can go like, what I showed here, it can go to the brain, the heart, the muscle, or intestines, or the liver, depending on which part of the body is damaged. So I think what interesting here is what are the potential diseases that can be treated with stem cell therapy? No, we don't have any evidence. Still, all these things are in a very infant stage. We are still doing a lot of research. What stem cells, where to help stem cells, in what way. So we can say that, like potential, got a heart stroke, or you got a respiratory disease. Like now, the Parkinson and also dementia is on the rise. Whether those are the areas where later stem cells play a role. The incidence of cancer is also increasing every year. Roughly we see about 1,000 new cases per million population in Malaysia. That means our population is 34 million. Roughly we are estimated to see about 34 to 36,000 new cases a year in Malaysia. So we are trying to see how stem cells can help in oncology. I'm not sure, in this hall, I'm sure you have friends who have undergone chemotherapy, and it comes with a lot of side effects. Like, number one is hair loss. You lose your hair. And then the sore mouth. You get sore mouth while having chemotherapy or radiotherapy. So, can these stem cells help? I'm sure we do research. There is a role where stem cells certainly will be able to help the damaged tissue recover. So like, you can have increased risk of infection, you can have bruising, or nausea, vomiting, because, it disturbs the stomach, and loss of fertility. So these are a few side effects from the chemotherapy. So if these are the places where the body will require a lot of stem cells, so why not we try to have a mechanism where you give patients stem cells, so the recovery, the regeneration, that's what we are talking about, regenerative medicine. How the cells can regenerate faster and patients don't have to suffer from the side effects. So now we have immunotherapy. Now the cancer treatment is no more chemotherapy. We have target treatment, we have immunotherapy. Now what we are trying to do is immunotherapy is very expensive. Is it possible to use stem cells together with immunotherapy but less dose? We don't know. A lot of answers we don't have. So this is in later part where we can sort of one day come and say that yes, we can give a lower dose of immunotherapy which is very expensive and together with our stem cells. And these are things which we have to look in the future. So stem cell therapy is going to be very interesting. It's something for the future. What we can do is we need more research, and I think a lot of research is being done on stem cells now. They are already doing immunotherapy. Now for cancer patients we are already using immunotherapy, but not every patient is fit for immunotherapy. You have to do molecular testing whether the patient is fit for chemotherapy. This is treatment chart or CART. But unfortunately, when this thing came to the market about 10 years ago, everyone was excited. But unfortunately, this only can be used in certain cancers, lymphomas, also very limited role, and basically it has very limited role in solid tumors. So this one came but didn't show much progress, unfortunately. So what is the perspective on stem cell therapy? The future of medicine such as stem cell therapy with adequate research can have the potential to treat chronic conditions that have no cure. So one day we may be able to use these cells in cancer treatment. That will be a great thing, because the cancer incidence is increasing and the cost of treating cancer is very high. And this leads to a better disease management and increased quality of life of patients. So basically here we want to give patients a good quality of life while undergoing treatment with minimal side effects and the role of stem cell. Thank you.